Fatty liver, also known as hepatic steatosis, is a condition in which excess fat accumulates in the liver cells. The normal liver is expected to have a small amount of fat, but when the fat content exceeds 5 to 10% of the liver's weight, it is considered fatty liver disease. This excess fat can interfere with the normal functioning of the liver and lead to inflammation, potentially progressing to more severe conditions. If left untreated, fatty liver can progress to more serious stages, and this can lead to a condition known as non-alcoholic steatohepatitis, NASH. NASH is characterized by inflammation and liver cell damage, and it can further progress to cirrhosis, fibrosis, and ultimately liver failure. Cirrhosis is a late stage of scarring of the liver tissue, and it can result in the loss of liver function. Moreover, individuals with fatty liver disease are at an increased risk of developing complications such as liver cancer. Therefore, neglecting treatment for fatty liver can have serious consequences for both liver health and overall well-being. So, what causes fatty liver? Fatty liver disease is often associated with a diet high in unhealthy fats, sugars, and excessive calories. Consuming too much of the following types of foods can contribute to the development of fatty liver. Saturated and trans fats. These are found in fried foods, processed snacks, baked goods, and fatty cuts of meat. Foods high in saturated and trans fats can increase levels of bad cholesterol and contribute to liver fat accumulation. Added sugars. Foods and beverages with high amounts of added sugars, such as sugary drinks, sweets, and processed foods, can lead to insulin resistance and contribute to the accumulation of fat in the liver. High-calorie foods. Consuming more calories than the body needs, especially in the form of high-calorie processed foods, can contribute to weight gain and increase the risk of fatty liver disease. Refined carbohydrates. Foods with refined carbohydrates, such as white bread, white rice, and sugary cereals, can lead to spikes in blood sugar levels and contribute to insulin resistance. Excessive alcohol consumption. Chronic alcohol consumption is a well-known cause of fatty liver disease. Alcohol is processed by the liver, and excessive intake can lead to liver inflammation and the accumulation of fat. Now that we know some of the causes, let's talk about the signs and symptoms of fatty liver disease. Number 1. Right shoulder pain. Believe it or not, there is a surprising connection between fatty liver and right shoulder pain. The liver is located on the right side of the body, just beneath the rib cage. As the liver becomes enlarged due to excess fat, it can press against surrounding organs, including the diaphragm and the gallbladder. This pressure can radiate to the right shoulder, causing discomfort and pain. This phenomenon is known as referred pain, where the pain originating from one organ is felt in another part of the body. In the case of fatty liver, the pressure on the diaphragm and surrounding structures can send pain signals to the right shoulder, creating a connection that might be unexpected for many individuals. Number 2. Abdominal fat. As the liver becomes fatty, it struggles to respond to insulin properly. Insulin is a hormone that helps regulate blood sugar levels and also plays a role in fat metabolism. When insulin resistance kicks in, your body compensates by producing more insulin. This excess insulin promotes the storage of fat, particularly around the abdomen, leading to the infamous spare tire or visceral fat. But that's not all. The inflammation caused by fatty liver further exacerbates the problem. Inflammatory signals released by the liver can directly impact fat cells in the abdominal area, promoting their growth and retention. So, not only does fatty liver contribute to insulin resistance, but it also fuels inflammation, creating a perfect environment for the accumulation of abdominal fat. Number 3. Low thyroid function. The liver plays a crucial role in thyroid hormone regulation. Your thyroid produces hormones like T3, triiodothyronine, and T4, thyroxine, which influence metabolism and energy production. The liver helps convert T4 into its more active form, T3. When the liver is burdened with excess fat, this conversion process can be disrupted. So, how does fatty liver affect thyroid function? Research suggests that an accumulation of fat in the liver can lead to insulin resistance and inflammation. Insulin resistance can disrupt the balance of hormones in the body, affecting the conversion of T4 to T3. This imbalance may contribute to low thyroid function, also known as hypothyroidism. Number 4. Fatigue. We often associate fatigue with a lack of sleep or a hectic lifestyle, but did you know that your liver health could also play a crucial role in your energy levels? When your liver is overwhelmed with excess fat, it becomes less efficient in performing its essential functions. One of these functions is to regulate blood sugar levels. A compromised liver may struggle to maintain steady blood sugar, leading to energy crashes and feelings of fatigue. Additionally, a fatty liver can impact your metabolism. The liver plays a key role in metabolizing nutrients and converting them into energy. When it's bogged down with fat, this process becomes less efficient, leaving you feeling tired and sluggish. Furthermore, inflammation in the liver caused by fatty deposits can trigger a systemic response in the body. This inflammatory state can contribute to feelings of fatigue, as the body diverts energy to address the inflammation rather than supporting your daily activities. Number 5. Edema. So, how does a fatty liver lead to edema? Edema is the accumulation of excess fluid in the body's tissues, causing swelling. The connection lies in the liver's role in maintaining a balance of proteins and fluids in the bloodstream. One of the liver's crucial functions is the production of albumin, a protein that helps regulate blood volume and prevents fluid leakage from blood vessels into surrounding tissues. When the liver is healthy, it produces enough albumin to maintain the proper balance of fluids. However, in a fatty liver, the reduced production of albumin can disrupt this balance, leading to fluid retention and edema. Edema commonly affects the lower extremities, causing swelling in the ankles and legs. This fluid retention occurs when the weakened liver struggles to regulate the fluid balance and the excess fluid seeps into the surrounding tissues. Number 6. Itchy skin. Imagine this scenario: you've been experiencing persistent itching on your skin, and you're wondering what could be causing it. Well, one potential culprit might be lurking inside your body, the fatty liver. But how exactly does this organ contribute to that irritating itch? Let's find out. The key lies in the liver's role in detoxification. One of the liver's crucial functions is to filter toxins from the blood. When the liver is overwhelmed with excess fat, its efficiency in detoxifying the blood is compromised. As a result, these toxins can accumulate in the bloodstream. When toxins build up in the bloodstream, they can trigger an inflammatory response throughout the body, including the skin. This inflammation can lead to itching and irritation. Number 7. Dark urine. The liver is responsible for producing bile, a greenish-yellow fluid that aids in digestion. Bile is eventually excreted into the small intestine, but during this process, a small portion is also directed to the kidneys, influencing the color of our urine. When the liver is compromised by excessive fat, the production and flow of bile may be affected. This can result in a change in the color of your urine, causing it to become darker than usual. Number 8. Abdominal pain. As fat accumulates in the liver, it can cause inflammation and scarring, leading to a condition called non-alcoholic fatty liver disease, NAFLD. As NAFLD progresses, it can cause various complications, one of which is hepatomegaly, an enlarged liver. An enlarged liver doesn't just peacefully coexist within your body. It can start putting pressure on surrounding organs, including the stomach and intestines, leading to abdominal discomfort and pain. This pain is often described as a dull ache or a feeling of fullness in the upper right side of the abdomen. Number 9. Spider veins. Spider veins are small, dilated blood vessels that resemble spider webs, often visible just beneath the skin's surface. Now, you might be wondering, how can a fatty liver possibly lead to the development of spider veins? The answer lies in the intricate relationship between the liver and the circulatory system. The liver plays a crucial role in maintaining overall blood flow and regulating blood pressure. When the liver is compromised due to excess fat, its ability to perform these functions may be impaired. The compromised circulation can cause blood to pool in smaller vessels, leading to the development of spider veins. Essentially, the weakened liver function contributes to venous insufficiency and the appearance of these visible veins. Now, let's move on to the steps you can take to reverse this condition. The first and crucial step is adopting a healthy diet. Focus on whole, nutrient-dense foods like fruits, vegetables, lean proteins, and whole grains. Reduce your intake of processed foods, sugary beverages, and saturated fats. Also, limit your alcohol consumption, as it can contribute to fatty liver. Exercise is another key factor in reversing fatty liver. Aim for at least 150 minutes of moderate intensity exercise per week. Exercise helps burn excess fat, improve insulin sensitivity, and promote overall liver health. Maintaining a healthy weight is crucial for reversing fatty liver. If you're overweight, losing just 5 to 10% of your body weight can significantly improve liver health. Don't forget the importance of staying hydrated. Water helps flush toxins from your body and supports overall liver function. Lastly, don't neglect regular checkups with your healthcare provider. Remember, these lifestyle changes take time, so be patient and consistent. If you found this video helpful, give it a thumbs up, share it with someone who might benefit, and subscribe for more health tips.